Good evening and thanks for staying tuned. Welcome to our COVID-19 update. Others are here are the highlights. 253 Nigerian returnees from the United Kingdom arrive Abuja to start 14-day quarantine period. $120,000 people could be positive for COVID-19 in Lagos alone by July of 2020, so says the state government. And Italy becomes the third country to get more than 30,000 deaths from COVID-19. As the COVID-19 pandemic continues to spread across the world, killing thousands, scientists and governments are on the lookout for safe and effective treatments to help those who are sick. And yet, a large issue with COVID-19 is that as yet, there isn't any cure. The World Health Organization announced it has launched solidarity trials to help find an effective treatment for COVID-19, and there are countless smaller ones coordinated in countries worldwide. More than 150 different drugs are being researched around the world. Most are existing drugs that are being tried against the virus. With no vaccine or specific antiviral drug regime used to treat critically ill patients, the management of patients mainly focuses on the provision of supportive care. The issues surrounding the treatment of COVID-19 are part of our focus tonight. But first, today's top stories. 253 Nigerian returnees from the United Kingdom just over an hour ago arrived at the Nnamdi Azikiwe International Airport in Abuja. The returnees arrived in Abuja after initially landing in Lagos at the Murtala Mohammed International Airport. The airlift to Abuja had been delayed for a couple of hours, a situation for which the Foreign Affairs Minister, Mr. Geoffrey Onyema, had apologized at today's Presidential Task Force on COVID-19 briefing. The Nigerian High Commission in London had announced that the plan to evacuate about 700 stranded Nigerians in batches had begun and listed procedures to be followed in the exercise. The arrival is coming 2 days after 256 citizens were evacuated from the United Arab Emirates by the federal government. Our correspondent, Bukola Joe Oketumbi, now reports.
Nigerian evacuees from the United Kingdom make their way out of the parked British Airways aircraft. Over 250 citizens are back in Lagos to proceed on this Air Peace plane for their transit to Abuja, where they will be isolated for 14 days. 5 hours after they arrived, they were still on the tarmac owing to logistics.
We've been working frantically with all the different parties concerned to try and get those passengers who have been staying on the tarmac and the airport for over 2 hours. This is really a most regrettable situation, and we apologize wholeheartedly to those passengers for having put them through that.
While the evacuees have deboarded, the same aircraft is airlifting 258 UK nationals and 34 crew to London once it has been disinfected. A top official of the High Commission is happy over both countries' collaboration.
And we've taken home so far nearly 1,500 British people back to the UK. It's been excellent cooperation both here in Nigeria and in the UK in order to make this happen, so really glad to be doing that today.
The United Kingdom is conducting its 6th evacuation flight from Lagos and is hopeful this may be the last. Bukola Joe Oketumbi, Channels Television News.
In Lagos, the state government is forecasting that cases of COVID-19 in the state may increase to 120,000 by July of this year. The State Commissioner for Health, Professor Aki Abayomi, disclosed this during a press briefing today. Professor Abayomi explains that the state will likely commence trials in about a week, as the state is currently manufacturing sample collection kits and is working hard to get more tests reagents.
Predictions that Africa is just starting her journey in the COVID-19 pandemic race look like they may be true, going by the way the numbers are rising every day. From the time the lockdown in Lagos was eased, the state has been confirming cases in 3 digits, with the latest forecast from the state government alluding to this.
So our model suggests that by July, we're going to see somewhere between 90 to 120,000 positive cases. However, our testing algorithm only tests for people who have developed symptoms.
The search for a vaccine is also ongoing globally, and Professor Abayomi says there is no better time than now to start the hydroxychloroquine trials to discover its merit.
We're going to be receiving thousands and thousands of tablets made by the original manufacturers of hydroxychloroquine. And I think within the next week or so, we would have commenced the trials.
Concerning the recent returnees from Dubai, government says they will be quarantined until it is safe for them to rejoin the society.
So we're planning to test them today and on their 13th day of isolation before we allow them to return into community.
The state government is also concerned that some persons who have tested positive to the virus have decided to run away from treatment.
They shut their doors or they leave the environment in which we know they are. They don't answer their phone. I think this is because people are afraid to come to the isolation centers. Our isolation facilities are really very comfortable. It's not like the Ebola days. We've made a lot of improvement.
In the face of the sobering forecast, these measures may look like an uphill task, but the commissioner believes the surest line of defense is social distancing, respiratory etiquette, and good personal hygiene. Mary Alale Yusuf, Channels Television News.
Nigerian clinicians are currently participating in the World Health Organization's solidarity trials to determine the efficacy of some of the drugs currently being used to treat COVID-19 patients. The Minister of Health, Dr. Osagi Ehanire, speaking today at the Presidential Task Force daily briefing in Abuja, also says local researchers should forward their findings to NAFDAC for approval.
Nigerian clinicians are participating in a WHO, World Health Organization, sponsored study called Solidarity, that's the title, in which they are trying to get experience across all countries of the efficacy of certain drugs. That includes chloroquine, hydroxychloroquine, and antiretroviral drugs, and azithromycin, and so on. So the study is going on. They are participating in these clinical trials of these drugs, and the antiretroviral is just one of them. The results will come out, I believe, when they have been collated across all countries. As for indigenous medicines, there are processes. Anybody who has indigenous, who has made any, whether herbal medicine or any invention, is referred to the Nigeria Institute for Pharmaceutical Research and Development, or to the TCAM department, that's Traditional, Complementary and Alternative Medicine Department of Federal Ministry of Health, for evaluation. At the end of the day, everything will go, they can send whatever samples they have to the NAFDAC, National Agency for Food and Drug Administration and Control, for examination and to test, do all the necessary tests. Nothing needs to go through the ministry itself. You can also approach the NAFDAC by yourself. Even if you are manufacturing water, you know you have to send it to NAFDAC for assessment and also for a NAFDAC number.
The head of the Public Health Department of the Federal Capital Territory Administration says the easing of the lockdown has made community testing and contact tracing more difficult for the department. Speaking with our correspondent, Kayla Megwa, the director also speaks on the treatments available for patients of COVID-19 and the case to be made for indigenous treatments.
Of the 3,526 cases of COVID-19 in Nigeria, 107 people have died, while 601 people have been discharged. People being discharged means that some drug being administered to COVID-19 positive patients must be working. For the Director of Public Health at the Federal Capital Territory Administration, the drugs for treatment are not the problem. The ease of the lockdown in Abuja has increased community spread of the virus, and she fears the next few weeks will see an explosion in the number of cases.
So 3 days ago, we have over 180 cases that came out of our community, and they have been there silently. As a scientist, you should know that once people are let out of that lockdown, it's going to be worse. We might not realize the effect now until maybe the next 2, 3, 4 weeks. So now we've discharged 40 cases. So that means the treatment we are using now is working.
What drugs are being used right now in the nation's capital to treat people who are positive for COVID-19?
We are using antibiotics and antiviral. We then chloroquine, right? Hydroxychloroquine is being used, and we have the Alluvia, which is the antiviral, and the antibiotics, azithromycin and augmentin. We treat, and then for the people that have comorbidities, the comorbid conditions are being handled alongside with the management of COVID-19.
Can a case be made for indigenous drugs for treatment of COVID-19?
There hasn't been any case of COVID-19 that anybody has said, oh, I confirm this case, right, by virological evidence that this person had COVID-19, and they have treated with so and so, and this is the outcome. So without that, we don't have to be wasting our energy on such. What we need to do, if there is any way we can build up a research, building research to know that we are fighting COVID-19. These are what we need to do.
Not much is in the public domain on these COVID-19 treatments for good reason. According to Dr. Josephine, there's a fear that criminals might begin the manufacturing of fake versions of these drugs. Many people might start to self-medicate, as was seen with hydroxychloroquine, and people may no longer present themselves for testing.
Kayla joins us now from our Abuja studios. Good evening, Kayla. Nice to see you once again, and trust that you're keeping safe.
Good evening, Laddie.
So now we know at least some of what is being used to treat people, but something that appears that was not being said there is that the fact that some of this is now known doesn't mean that these are approved treatments for general use.
Absolutely, Laddie. These are still trials. Everything is still in the trial phase. Some things are working for some people, some things are not working for other people, which is the reason why everybody needs to calm down with the request for, oh, what drugs are being used. And she did express that fear. You know, it's a little strange, really, to a lot of Nigerians that, well, if people are getting treated, why don't you want to tell us what's going on? But for good reason, as I stated earlier. She says, you know, it's important that people don't know exactly what is happening because, you know, we have a lot of people who would create fake versions. And then the biggest problem, which is that many people will stop presenting themselves for testing as a result of self-medicating. So, yes, it's important to put that out there, Laddie, and I'm glad that we're doing this right now. These things are still in trial phases. Even all the drugs that we're hearing about, even the ones that are being talked about at the PTF every day, you know, these drugs are still in the trial phase. The safest thing to do right now is to observe social distancing, keep yourself away from people who are infected, put on a face mask, and if you feel any symptoms, bring yourself to the NCDC so that it can do a proper test, isolate you, treat you, and then send you back to your family, Laddie.
Something that she mentioned, which may also not be completely well heard, is where she talked about the fact that contact tracing and getting people who are under surveillance anyway has been made more difficult by the ease of the lockdown. Did she provide you any more details about that?
She was very emphatic about that. In fact, when I talked to her about, you know, what our theme for today was supposed to be, she said she wanted to talk more about that, actually, you know. She said the easing of the lockdown has been very difficult for them. I asked her, whether she wanted another lockdown, and she said yes, because that would help them do their job a little bit better. She talked about how community spread has increased exponentially in the nation's capital. And as she said in that report, she said it over and over again. In the next few weeks, we're probably going to be shocked at the numbers that we're going to be seeing from the nation's capital, according to her. And she said, the ease of the lockdown means everybody's outside. Many people are not observing the rules of social distancing and wearing your face mask that people are supposed to. And she's afraid, that, maybe all of the work that was, accomplished during the first lockdown may have been, may vanish by the time this eased lockdown is assessed in the next 1 week or so. But she really did express fears, Ladia, about the next 2 or 3 weeks. And we're watching to see how that works out. And I think it's a note of warning for people. If someone who's in charge of community testing for the FCTA is worried about the spread of the disease in the next few weeks, then maybe people should be a little bit more careful with the way they live their lives every day.
Thank you very much, Kayla. That sentiment, of course, was expressed by the Lagos State Commissioner of Health as well, Professor Kebayomi, talking about the fact that now that people can go out, they're not finding it easy to keep in touch with those that they had placed under surveillance. That report, of course, earlier in the bulletin. But for now, thank you, Kayla. Thank you so much, our correspondent Kayla Megwa from our Abuja studios. Now, going by figures from Johns Hopkins University Coronavirus Resource Center, over 1.3 million people worldwide have recovered from COVID-19. That's out of a total of 3.9 million confirmed cases. Currently, as we've said before, no antiviral medication is recommended to treat the disease and no cure is available. No specific treatment exists for COVID-19 as treatment is directed at relieving symptoms. In the meantime, the World Health Organization is coordinating solidarity clinical trials for COVID-19 treatment. And as of April 21st, 2020, over 100 countries are working together to find effective therapeutics as soon as possible via such trials. The Solidarity trial will compare 4 treatment options against standard of care to assess their relative effectiveness against COVID-19 by enrolling patients in multiple countries. The Solidarity trial aims to rapidly discover whether any of the drugs slow the disease progression or improve the rates of survival. Based on evidence from labs, animals, and clinical studies, the following treatment options were selected: remdesivir, lopinavir, or ritonavir, depending on where it is being treated, with interferon beta-1a, and chloroquine or hydroxychloroquine, which you've already heard being mentioned earlier on. Until there's sufficient evidence, though, the WHO cautions against physicians and medical associations recommending or administering these unproven treatments to patients with COVID-19 or people self-medicating with them. The WHO is concerned by reports of individuals self-medicating with chloroquine and causing themselves serious harm. Joining us via Skype from Lekki area of Lagos is a consultant public health physician, Dr. Bolanle Balogun. Good evening, Dr. Balogun. Thank you for your time.
Good evening. Thanks for having me.
We've said that there are no approved treatments as at now for universal application. But the treatments that are currently being tried and that are currently being used, by the rates of those who have recovered, can we say that these treatments are actually quite effective, even though not completed in terms of the approval procedures?
Well, we cannot say categorically that they are effective until they have gone through the whole scientific process that they need to. Some of these clinical studies that you mentioned are not the gold standard when we talk about testing for the efficacy of drugs. That's the randomized control trials. Some of them are limited by the small sample size, that is the number of participants in the study, and then also the design of the study. So we are very careful until these drugs have gone through randomized control trials after showing effectiveness in preclinical trials, and then going through the phase 1, phase 2, phase 3, that's the randomized control trials, before we say that such a drug is effective. And that's why, like you said, the World Health Organization is going through this solidarity trial to ensure that a lot of resources, a lot of rigor careful thoughtfulness is put
Please
into.
hold those thoughts. I'll come back to where you stopped. We just have to take this quick break at this moment. We'll be right back. Thanks for staying tuned. I still have Dr. Bolanle Balogun with me. Dr. Balogun joins us via Skype from the Lekki area of Lagos. Dr. Balogun, thank you once again for your patience and for taking out the time to be with us. Now, you were talking about the fact, the protocol, and that until and unless that protocol is completed, you cannot say that a drug is effective and can continue to be used or have general applications. Did I get that correctly?
That is correct. If you take the example of remdesivir, we have early results showing that it's positive. It reduces the duration of time people are ill. However, they're still going on. They're not stopping the process. Sometimes when you have emergency situations, as we have in this pandemic, and you see early results, you can start using it, which is what is happening. It does not mean that you stop the process. So they still go on, complete the entire trial, and then even when the drug is in use, after the randomized control trial, we have a phase 4, where you have to keep monitoring the use of the drugs. And recommendations can change at any of this time. And because this is a new disease, we're seeing that. So we need to still watch. We're learning and seeing how these treatments go. So hopefully we'll get more than one suitable treatment as research goes on.
The other question, of course, has to do with what is described as indigenous treatments. That is, treatments emanating from here within the country. And quite a lot of people have talked about the fact that in a place like Madagascar, for example, that they're pushing some homegrown treatments and all of that. Can a case be made here for indigenous treatments, do you think, given your own experience?
In my experience, I would say yes, a case can be made. We know that a lot of our scientists are not adequately funded to do this rigorous process, this rigorous scientific process that I described. So if someone has a technique, a drug, a herb that they have tested in preclinical trials, that is maybe in the lab or amongst animals, or there's any indication that it can work, it is important that we pay attention and connect them to the people, maybe NAFDAC, the Federal Ministry of Health, the institutions that support the work of traditional medicine. So we need to connect them and then also support them with funding and mentorship. A lot of them might not know how to conduct these randomized clinical trials. These claims need to be validated. However, we see in the communities, people, social media will say, oh, something works. This is a cure. This leaf is a cure. This herb is a cure. However, nothing should be recommended as a cure for COVID-19, no matter what other health benefits it gives, until it goes through this rigorous process. So yes, we can make a case for them. Yes, we can support them, with funding, giving them attention, linking them to where their claims can be tested, investigated. And then you never know who says that a treatment, an accurate treatment, an effective and safe treatment for COVID-19 cannot come from Nigeria. I don't think that is the case. I think that it can come from here.
Dr. Balogun, thank you so much for your time. Dr. Balogun joined us via Skype from the Lekki area of Lagos. Thank you so much for your time.
Thank you.
381. That's the highest single-day number of confirmed COVID-19 cases recorded in Nigeria, and that's in the last 24 hours, as announced by the Nigeria Center for Disease Control, the NCDC. This brings the total number of confirmed cases to 3,526, with 601 patients discharged and 107 people losing their lives to the disease. The number of active cases being managed across the country now stands at 2,818. The Southwest region continues to hold the highest number of cases. The 6 states in the region account for 1,708 cases, and Lagos has the highest chunk of this number. The North Central follows with a total of 364 cases. The FCT continues to lead in that region. The North Central follows, Borno State tops the list of total cases in the Northeast, having 125 of the region's 379 cases. With 4 new cases in the South-South, the total confirmed cases in the region stands at 121, and Edo State has more than half of these cases. Enugu recorded 1 new case, bringing the number of cases in the state to 9, and a total of 19 confirmed cases in the Southeast. The website of the Nigeria Center for Disease Control has more details of how you can protect yourself from COVID-19 by taking precautionary safety measures. In his first outing since he was discharged after testing positive for COVID-19, Kaduna State Governor Nasir El-Rufai was out this morning monitoring compliance of the lockdown at the boundary between Kaduna and Kano states. The governor climbed some of the trucks himself to ensure that they were not carrying concealed passengers along with their legitimate goods. He turned back trucks and other vehicles coming to Kaduna from Kano. Only petrol tankers and vehicles carrying food items were allowed to pass after rigorous screening of such vehicles. Governor El-Rufai's decision to enforce the lockdown follows reports that some unauthorized vehicles were still coming to Kaduna from Kano and other parts of the north using illegal routes.
Well, I'm quite concerned about the lack of compliance with the order of Mr. President banning interstate travel. What we have seen is that people are taking advantage of the exceptions given for the transportation of food and other essential items to be transporting human beings that constitute a way of spreading the virus. So I decided to come here to the border with Kano State to see for myself how the enforcement is going. And I'm very, very pleased with the efforts, particularly of our local government chairmen of Ikara, Makarfi, and Kubau, in trying to contain the entry of people from Kano. And it is our duty to ensure that we protect our people from the spread. Many of the vehicles are not obeying the guidelines. We have our mobile court here to try and convict them. And the health officials of both the local government and the state government are here to test, to carry out preliminary temperature tests on people. And all the security agencies are here.
From Kaduna to Bauchi State, where our correspondent Hajara Aliu has the update.
The figures of the coronavirus cases in Bauchi State has hit 100. As we speak, there are 102 confirmed cases of the coronavirus in Bauchi State, slightly below the numbers in Borno and Gombe states in the northeast. The challenge now here is that so many people in Bauchi are still living in denial about the existence of this virus. It takes a lot of persuasion to take samples from people, and even more persuasion to get people to isolate after they have tested positive. That's why we've seen 1 or 2 persons escape from the isolation center. The problem of denial was one of the reasons why the Bauchi State Governor called for a stakeholders meeting.
We are continuing with the partial lockdown up to the end of Ramadan, but we will intensify the issue of surveillance, contact tracing, and then the enforcement of no entry through our borders. And in the next 1 week after we would have provided some minimal support for the wearing of masks, we will make it mandatory for everybody conducting his or her business to wear masks.
If the number of cases keep climbing in Bauchi State, the government would have no choice than to review some of the measures that have been put in place to contain the spread of the virus.
Thank you, Hajara. And moving on to Enugu State, where in a bid to avoid the community spread of the coronavirus there, Governor Ifeanyi Ugwuanyi has announced new regulations and guidelines for the operation of markets effective from Monday. Governor Ogwai, in a broadcast today, told all that markets in the state will be allowed to operate between 7 a.m. and 4 p.m. daily to enable traders get home before the 8 p.m. curfew. The Ogbeche main market is expected to abide by the initial guidelines of alternating the market days between those dealing in pharmaceuticals and dealers in food items. Physical distancing protocols and the use of face masks remain compulsory. In the studios here with me, I have Dr. Tony Adeyemi, who is a public health physician. Thank you for your time.
Thank you for having me, Mr. Ladi.
Now treatments. We've talked about a number of other things, but now this, I don't know whether to call it vexed issue of treatments. Nothing has been approved formally yet, but we're treating people and they are recovering. I don't know how possible it is to keep them quiet about what it is that was being used to treat them. How do you think we can approach this issue of treatment best without breaching patient confidentiality, but at the same time reassuring people that you have COVID-19 does not mean you're going to die?
All right, thank you. I think the first thing to actually emphasize to the general public is that coronavirus infection is a viral infection. And most times, viral infections are self-limiting, meaning they run their course, and after a while, the patient recovers. After a while, the virus becomes undetectable in the blood. That's why you can now have a negative result after a while. So clinical trials are going on. There are different phases of these clinical trials. We've heard of the WHO Solidarity trial, which is going on. So in the phase 2 of the trial, you initially test the drug among a few patients. Then you now move on to the most important, which is phase 3, where you have the randomized control trial. In the randomized control trial is actually like an experiment. So you divide the patients into two. You have the control group and you have the test group. The test group are actually the ones that receive the trial drugs, but they do not know that they are receiving the trial drugs. Even the investigator does not know. That's the process called double blinding, so that you can avoid bias as much as possible. So even the patients are not aware. So most times they give them unmarked drugs, so you don't know if you're taking hydroxychloroquine, if you are taking remdesivir or whatever, you don't know what drug you're taking. So that's the process of randomized control trial, such that at the end of the day, you can now compare results and know how effective your treatment is. And thankfully, the Director of Public Health, which we spoke to in Abuja, also mentioned some of the setbacks which could occur when some of these drugs are actually released into the public, because you could have people self-medicating, you could have people also making these drugs also and trying to sell to the public. And phase 4 of the drug is when you actually know how safe this drug is, the long-term effects, the adverse effects of these drugs. So we all need to be careful. We need to be patient and wait for the results of the clinical trials to actually come out before we can now authoritatively say that this is the cure or this is a treatment for coronavirus infection.
People are worried because a number of predictions. Yesterday, the WHO said, look, if it goes uncurtailed in Africa, the numbers who dying could reach 190,000. Today, the Lagos State government, through its Commissioner for Health, says, look, in Lagos alone, we could have 120,000 people by July. Not dying, but having COVID-19.
Yeah.
Now, against that backdrop, one can understand why there is anxiety over treatment. Now, would you make a case, just like I asked you, Dr. Balogun, would you make a case for a look at indigenous treatments?
Oh, yes, most definitely, because coronavirus infection comes with different symptoms. And some of the local remedies that we have been seeing out that have even actually gone through formal channels, like rights to the Federal Ministry of Health, straight to NAFDAC, we've seen some of them. There are things that actually take care of some of the presentations of coronavirus infection, the symptoms like the dry cough, the sore throat. So there are things that have been known right from time to take care of these things. So it's good to look at indigenous methods, but they still need to be validated. So they still need to go through the right channel. These trials still need to be conducted such that there are safety levels, because in phase 2 of any drug drug trial, you try and get the dose response curve. At that point in time, you're looking for the exact dose that will bring you the results, desired outcome that you need. But if you prescribe or talk about these medications without any scientific method, people can overdose on it. It could have toxic effects on the liver, on the kidney, and so on. So that's why these drugs, however being indigenous, have to go through right channels, but won't totally discard them. They are welcome, but they should be validated properly and through the right bodies.
Now, the remdesivir, I hope I got that right,
yeah,
because it's a new. The major advantage it is said to have is that it reduces recovery time. So
yes.
that means that people don't have to occupy bed spaces in isolation. Now, some people will say that's a perfect fit for our own situation, because even today, the Director General of the NCDC was saying, look, now we have 3,500 cases. That's already in excess of our capacity. And for some predictions, we are just beginning. How do we go about using something like that, even though it is still going through the process of validation, if indeed we are to use such a thing?
Okay, but as already explained, we're in an emergency situation right now. It's a pandemic that is going on. That's why even the Solidarity Trial by the World Health Organization, they've been able to bypass, but bypass in a positive way, not bypass in a negative way. They've been able to bypass some of the rigid protocols that they need to go through before a randomized control trial can actually be carried out. So I'm sure that even currently here in Nigeria, these drugs, because Nigeria is part of the countries that are participating in the Solidarity Trial. So some of these drugs are already being tested and being used already. That might also be why we're having, but we cannot conclude yet. We only have a hypothesis that we have formulated, but these hypotheses need to be correctly tested and statistically proven to be sure that it's efficacious. On the other hand, our bed occupancy rates, we're having so many people now, we do not have enough space. So Nigeria is tilting gradually towards the home treatment of coronavirus infection. So we need to be sensitizing people more, because we are going to get there pretty soon. Fine, we can build more isolation centers around Nigeria, but it's going to come to a point where asymptomatic cases or mild cases can actually stay at home and get better. And that's where traditional and home remedies might actually come into play, because by the time they've been validated to a reasonable extent, and you know that, okay, I'm asymptomatic, but I just have an itchy throat, or I just have a dry cough, then this is all I need to take to feel better. So there's actually a place that goes back to your previous question on the local remedies and home treatment for coronavirus infection.
Finally, and very briefly, let me ask you about the fact that now that we are easing the lockdown, some of the health authorities are reporting that it's getting more and more difficult to get people to come in for testing and to follow on contacts and so on, because you can hardly find anybody at home anymore. Did we do this too soon, you think?
Well, we had 5 weeks, because the aim of the lockdown in itself was not to automatically flatten the curve. It was to put strategies in place such that we have a framework, we have a way to trace people, we have a way to identify the contacts of confirmed cases. We have a way of also confirming cases. So it gave us adequate time to put some of the structures in place. If we had more time, that would also have been a plus and a benefit. But then, we had to weigh the economic benefits of the lockdown and all, and put everything together. Exactly. So it gave us just an adequate time to try and put some of these strategies in place, because we already have Nigerians coming back. We have where they're going to quarantine them. So some of these structures, it's already taken shape. So it was actually a good thing that we had to lock down then.
Dr. Tony Adeyemi, thank you so much for your time.
Thank you very much for having me.
We'll take a break at this point. When we come back, we'll go beyond our shores, where Italy has become the 3rd country in the world to record 30,000 plus deaths from COVID-19. Please stay on with us. Thanks for staying tuned. Italy has become the 3rd country in the world to record 30,000 deaths from the coronavirus. It reported 243 new fatalities on Friday, down from 274 the day before, but taking its total to 30,201. Only the United States and Great Britain have seen more than 30,000 deaths from the virus. Let's take a look at other updates coming in from around the world.
Some smaller parks are opened in Madrid, Spain's capital, where authorities would temporarily pedestrianize 29 streets and open parks for people to exercise. However, the city's biggest parks, such as the Retiro and children's playgrounds, will remain closed. Italians, on the other hand, are getting used to queuing at bus and metro stations. Yellow lines sprayed on the ground guide commuters into the metro station, where strict social distancing is enforced. On May 4th, the government eased some restrictions of the lockdown into a phase 2, with millions of people across the country returning to work, but social distancing in place on public transport. China says it supports a World Health Organization-led review into the global response to the coronavirus outbreak after the pandemic is over. The country has come under increasing pressure after previously rejecting calls for an independent international investigation into the origin of the virus. Finally, U.S. unemployment rate has surged to 14.7% from 4.4% in April, wiping out 20.5 million jobs as the economy reels from the pandemic. It's the highest unemployment rate in the U.S. since November of 1982, when it reached the high of 10.8%.
We go to Washington, D.C. in the United States, where we're joined by our correspondent, Maria Bird. Good evening, Maria, and thank you for your time. Trust you're keeping safe.
Good evening.
US
staying safe, social distancing.
Indeed. U.S. unemployment rates, as you said, more than 20.5 million jobs lost in April. What more can you tell us about that?
Correct. Well, the projections are that we are headed toward a Great Depression era and that we have not seen this type of unemployment rate in over 100 years. And so many are very concerned about what is going to happen with the economy in the U.S. and obviously around the globe. But we know that projections are heading us toward an era that many in the United States have never seen before.
Now, states are reopening. Some of the states in the United States are reopening, but they are not meeting federal government guidelines. How is that possible?
Well, many states are unfortunately not following, because governors have the right to reopen their state. And the guidelines that were presented by the federal government are just that, they're guidelines. There's no hard and fast rule. The federal government is not coming in to ensure that these guidelines are being followed. And so many states are taking their chances because they are being pressured by many to reopen the states and cities because of the economy. And so this is really potentially causing a longer process with the recovery because we're still seeing escalated numbers. As it stands right now, the projections just this week have doubled in where the death toll could be by the time that we see a flattening of the coronavirus cases in the U.S.
The projections you just mentioned are as a result of people not really complying with the issue of social distancing, amongst other such guidelines, isn't it?
Correct. It's the social distancing, it's the washing of the hands, it's making sure that if you are feeling any sick symptoms, that you are getting immediate medical attention and medical care, and quarantining yourself, obviously, if you are having symptoms of COVID-19. And so those are the real challenges, because there is no real treatment option at this time. And most importantly, there is no approved vaccine.
Maria Bird, thank you so much for your time. Our correspondent, Maria Bird, reaching out to us from Washington, D.C. in the United States. Please stay safe out there.
Thank you.
And that's our package on COVID-19 update tonight. Thanks for being with us. I'm Ladi Akiridoluale. Do have yourselves a good and safe weekend ahead. Good night.